The Healthcare Federation of Nigeria is again partnering with the World Health Expo, a global medical exhibition company, on bringing together investors who can help strengthen small and medium-scale medical enterprises for structured and impactful growth to make them more attractive to local and international investors. Senior correspondent Jacqueline Ogo was at the leadership conference organized by both organizations, which had the presence of leaders in public and private global health sectors.
The ongoing Healthcare Leadership Conference has a major target, which is to ensure collaboration between private and public medical institutions and the healthcare products manufacturing sector, for them to gain enough capacity to attract supportive and impactful investments. The participants in the exhibition are from Africa and other nations. Africa's Center for Disease Control was clear on the need for African governments to ease off stiff regulations that hinder investments and partnership. He also advised African leaders to give topmost priority to the challenges of the continent's health sector, to pave the way for development and profitable global competition, even as they maintain positive steps they are already taking.
I think it's acceptable, for everyone to say you cannot talk about health security if you don't have manufacturing security, where Africa at the moment imports almost more than 60% of its consumables, whether it's vaccine diagnostics or medical technologies. Even the ability to cross other markets has been really restricted. We have almost 54 countries with different regulatory mechanisms in place, which can be a major barrier by itself.
Governments can't do it all, but what we must do is we must establish the standard. We must establish at least a couple of facilities that the private sector can look up to and say, this is the golden standard that the government is proposing, and there's an enabling environment for us because the purchasing power has increased, the demand is there, and supply needs to follow.
The Minister of State for Health and Social Welfare, Iziaq Salako, pointed at efforts already being made by the federal government to promote better health care.
The Basic Healthcare Provision Fund has also been expanded, has been reorganized, and every quarter now, about 50 billion is disbursed on the average to support basic health care for Nigerians.
The president of the Healthcare Federation of Nigeria encouraged more participation in healthcare exhibitions such as these.
During these kinds of meetings that, you meet partners or suppliers who can actually give you discounts. In fact, I was having a discussion just the other day with the Honourable Commissioner of Health in Ogun State. And she told me that she met one of the exhibitors here about 2 years ago, and since then Ogun State has purchased equipment of over $1 million. That shows you the power of this kind of partnerships.
How we can improve healthcare financing. So not only do we look at that for Lagos and the Nigerian market, but the whole African continent as well.
This is the window where healthcare providers in the private sector find discounts in the purchase of equipment to bring down the cost of healthcare services in the nation. At a time when many nations are battling to build their economies, watchers of the nation's health sector say global partnership for better healthcare delivery can actually not be undermined. Jacqueline Ogo, TVC News, Lagos.